And it's always lovely to have Dr. Pringsheim presenting to us. So we thank her very much. We're very appreciative. She is a professor of the University of Calgary, Department of Clinical Neurosciences, Psychiatry, Pediatrics and Community Health Sciences, Program Lead of Tourette and Pediatric Movement Disorders, Deputy Director of Clinical Research at the Matheson Center for Mental Health Research and Education, President of the Tourette OCD Alberta Network, and is an evidence-based medicine and methodologist of the American Academy of Neurology. Thank you, Dr.
Thanks.
Pringsheim.
Thanks, Julian. Julian, are we recording? I can't tell that we're recording. Sorry, you're muted, so I couldn't hear your response.
Sorry,
Are we?
no, we are recording. I can see
Okay.
the
Okay,
flashing red
perfect.
dot.
Okay, great. Yeah, so thank you so much for joining us this evening to talk about complementary and integrative medicine for Tourette syndrome. So as I mentioned, we are recording, so it'll be best if we take all questions at the end of the presentation. So let's start with definition. So what is complementary and integrative medicine? So complementary and integrative medicine uses natural non-stream health practices and products like acupuncture, meditation, or herbal supplements alongside conventional medicine to improve health and well-being. And we call it complementary when it's used with standard treatments, and we call it alternative medicine when these treatments are used instead of standard treatments. And integrative medicine coordinates both conventional and non-stream approaches in a coordinated fashion. So why should we talk about complementary and integrative medicine in Tourette syndrome? So many people with Tourette syndrome express an interest in complementary and integrative medicine, and that's certainly been my own experience in clinical practice. I find that a lot of people at the end of a consultation visit, one of the most common questions I get is, what are non-medical treatments that I could use for my tics or my child's tics? Now, there was one study done in the United States at a specialty clinic, which found that 64% of people with Tourette syndrome seen reported using complementary or alternative medicine for their tics. And the most common modalities that were used were prayer, vitamins, massage therapy, and dietary supplements. And 80% of participants in this study said that they did not consult a doctor before starting these treatments. So we performed a systematic review of clinical trials of complementary and integrative medicine in Tourette syndrome. If you don't know what a systematic review is, it's a scholarly review of the published research evidence that follows a very sort of specific protocol. And this was a collaboration between the Movement Disorders Society, TIC and Tourette Study Group. I'm the chair of this international study group that's run by the Movement Disorders Society. And so it was a collaboration between the Movement Disorders Society and our own Tourette OCD Alberta Network. And we systematically searched for research studies which assess the effect of complementary and integrative medicine on symptoms of Tourette syndrome. So the aim that we had in doing this review was to answer these questions. In children and adults with Tourette syndrome or a chronic tic disorder, does complementary and integrative medicine reduce or improve tic severity compared to placebo or other treatment types? And in children and adults with Tourette syndrome or chronic tic disorder, does complementary and integrative medicine improve tic-related quality of life compared to placebo or other treatment types? And finally, in children and adults with Tourette syndrome or chronic tic disorder, does complementary and integrative medicine cause adverse effects compared to placebo or other treatment types? So this is basically how we did the search for studies. We had eligibility criteria of the types of studies we were looking for. So we were looking for clinical studies in patients specifically with Tourette syndrome or chronic tic disorder, and we excluded single case reports. Sometimes people will publish studies of, of a treatment in a single person, just saying what their experience is. So we did not include those types of studies. Participants in the research studies could be any age, and the interventions we were interested in were mind-body practices. So this is something like mindfulness, for example, would be a mind-body practice. We also looked at manipulation or body work. So that would include things like acupuncture, for example. We include studies of supplements. So these could be natural products, dietary nutrients, vitamins, or minerals. We include studies using traditional Chinese medicine. And then finally, we included studies of other integrative or lifestyle approaches. So a lifestyle approach could be something like exercise or diet. We looked at studies that had a placebo control, weightless control, or studies that did not have a comparison group. So in terms of the outcome measures we were interested in for these studies, we were interested primarily on the effect, as I measured, on tick severity and tick-related quality of life. So the most common scale to measure tick severity is something called the Yale Global Tick Severity Scale. And if you've ever been to our clinic, this is something that we do routinely at each visit. Basically, we are recording the number of different ticks people have, their frequency, their intensity or how visible they are, their complexity, and how much interference they cause in terms of movement or speech. And then we also look at tick-related impairment, which is a sort of overall impression of how much the ticks interfere with carrying out one's daily tasks or social role. And then for quality of life, there's one Tourette syndrome specific quality of life scale called the GTS qual. And so these two instruments were our preferred outcome scales when we looked at the studies. We looked at outcomes related to adverse effects, including serious adverse events. We would consider death or hospitalization to be serious adverse effects. And then we also looked at treatment discontinuation. And treatment discontinuation is important because this gives you an idea of the tolerability and acceptability of treatments to patients. We did not have any restrictions in terms of the settings that the studies were carried out in or the years that the studies were published. We had limitations on language, and this was due to we only included studies that were published in languages that someone on our research team could speak. Translating research studies is very expensive. So we had people on our team that spoke English, French, Spanish, German, and Polish. And we only included articles that were fully published and where we were able to see the full report of their data. So in terms of our information sources for looking for studies, we searched 3 different databases. So those were called Medline, Central, and PsycInfo. And we used a software called Covidence to track our literature search and facilitate our process. So when you do a search of the literature, you get a summary of each article. It's a 300-word summary that's called an abstract. And 2 researchers looked at each abstract and decided whether or not they thought it could potentially include the information we were looking for. And then we took out the data by a single person took out the data and a second person confirmed its accuracy. And then we did something called risk of bias, and this is a standard procedure that's done in scholarly review. So you can imagine that in any clinical trial that's done, there's different levels of quality. And there are things that can occur in a study protocol that can increase your confidence in the results. And there are things that can happen that can decrease your confidence in the results. So one of the things that has a big impact, for example, would be blinding. So blinding is when the investigator, the assessor, and the patient do not know whether or not they're getting the treatment or a placebo. Um, and I mean, we've all heard of the placebo effect. And so it's really important that studies have this characteristic for us to feel confident in the results of the study. So blinding is very important. Another important thing is something called allocation concealment. So the investigator and the participant shouldn't be able to predict whether or not they're going to get the treatment or the placebo, because again, that could potentially affect the results. Other things include whether or not the trial specified the specific inclusion and exclusion criteria for people to come in the study, how they decided to evaluate the outcome. So all of these points are evaluated for each study, and then we rate the studies as class 1, 2, 3, or 4 based on the fulfillment of these criteria. So a class 1 study, that's considered the best. And for a class 1 study, the person reading the study has little doubt that the results are true or a reflection of the truth. So that there's a high level of confidence in the study results when you have a class 1 study. In contrast, a class 4 study, you have very little confidence in the results of the study. And, one would not make a lot of decisions in terms of whether to use the treatment or not based on a study that was rated class 4. We would come to the conclusion that if we only had class 4 studies, that more research is needed, that a study of higher quality needs to be conducted. So a class 4 study would be one that was like a before and after, for example, right? So they rated tick severity before they started the treatment and then rated it again after the treatment was done. So in this situation, there's no placebo group. And so it's hard to know if it's just the passage of time or the treatment that's causing an effect. All right, so let's get into what we found. So we'll start with the mind-body practices. And the first one that we looked at was biofeedback. So this is a mind-body therapy that teaches people how to control involuntary bodily functions, such as heart rate or muscle tension, using monitoring equipment and instantaneous feedback. And with the guidance of a therapist, an individual will learn mental or physical techniques like visualization or deep breathing to change these physiological responses. And it's used in a number of different health conditions. It's used for stress management, it's used in chronic pain or anxiety. So there's one study that was published in 2019 in the United States, and this was a well-done study. It was rated class 1 that that looked at real-time functional MRI neurofeedback. And so with this sort of treatment, the participant is actually in an MRI scanner, and they're showing the participant the brain activity they have in a part of their brain called the supplemental motor area. And they're training participants how to control the activity in this brain region using this neurofeedback and evaluating this effect on tick severity. And they found that there is a significantly greater improvement in tick severity with neurofeedback compared to a sham treatment. And the amount of difference, so the mean difference between the treatment and the sham condition, was almost 4 points on the Yale Global Tick Severity Scale. And that would be considered a small but meaningful difference in scores. There's a few other biofeedback studies. There's another class 3 study, which was a negative study. They did not find any improvement with biofeedback. And then there are 4 class 4 studies, all of which reported some beneficial effects of treatment. There is one class 4 study of deep breathing, which consisted of deep, slow nasal respirations which found a positive effect on tick severity. There are 5 class 4 studies of hypnosis. Um, all of these reported some beneficial effects, but unfortunately, they were studies where we don't have a lot of confidence in the results. Now, there's one class 2 study of mindfulness treatment that was just published this year. And so in the study, they compared a video conference delivered group mindfulness-based intervention for tics, or MBIT, to a video conference delivered psychoeducation, relaxation, and supportive therapy treatment in 32 adults. The adults participated in 8 weekly 90-minute group treatment sessions, and they also had some home practice. And they found a significantly greater improvement in tic severity on the Yale in participants receiving MBIT compared to the supportive psychotherapy. And the mean difference was 7 points on the Yale, which is clinically meaningful and is about the same amount of improvement that we would see in patients taking aripiprazole, which is considered one of the most effective medications for tics. So this was overall, you know, a meaningful improvement in tics with mindfulness-based intervention. There are 2 class 4 studies also done by the same researcher. These were before and after studies, both reporting a beneficial effect. There's one class 4 study of something called resource activation, and this is a psychotherapy that focuses on resources, strength, and the potential of participants, but they found no improvement in tic severity with this method. There's one class 2 study of relaxation therapy, and in the study, they found that relaxation therapy improved participants' knowledge of relaxation treatment compared to a group that received a minimal treatment. But there was no difference between the 2 groups in their tic severity. So despite learning the relaxation techniques and showing mastery of relaxation, their tics didn't change. And there's 2 other studies, which are both class 4, which reported a reduction in tics with treatment. So we'll move on from here to manipulation and body work, and we'll talk about acupuncture. So there are 2 systematic reviews which summarize the literature on acupuncture for tics. One was on acupuncture alone. The other was on acupuncture combined with herbal medicine. In traditional Chinese medicine, tic disorders are believed to be caused by an excess of yang and a deficiency of yin, with the liver being the key organ involved. And the acupuncture points used in these studies focus on regulating the mind and calming the liver. So we used these systematic reviews rather than analyze this literature ourselves, mainly because all of the studies were published in Chinese, and we didn't have anyone on our team who was fluent in this language. And so these systematic reviews that I'm going to talk about, they looked at all these Chinese studies, and then they published their systematic reviews in English. So we were able to read them and evaluate them. So for this study by Liu, they included 22 studies of acupuncture, which included 1,600 participants. And all these studies were, as I said, done in China and reported in the Chinese language. And most of these studies compared acupuncture to antipsychotics. And antipsychotics would be considered by most doctors to be the most effective medicine for tics. Now, most of these studies were rated at a high risk of bias. We didn't have a lot of confidence in that these were well conducted clinical trials. And 15 of the 22 studies evaluated changes in the Yale scale. And they found that the mean difference between people receiving acupuncture versus people receiving antipsychotics was a difference of about 3 points on the Yale scale, favoring acupuncture. And that would be considered a small but meaningful difference. And when they did a sub-analysis of the data, they found that a significant improvement relative to the comparator was with electroacupuncture only. So electroacupuncture is when you combine electrical stimulation with the insertion of the needle. And when you do that, when you combine it with the electrical stimulation, it's thought to be a much more powerful physiological effect. So this is actually not surprising that when we use electroacupuncture that the results are more impressive. The same result has been demonstrated with migraine headache, for example, that electroacupuncture is more effective in preventing migraine than acupuncture alone. So we also looked at a second review that looked at studies of acupuncture combined with herbal medication and compared them to, what is referred to in the study as Western medicine, which would be sort of the medications that we typically use, like antipsychotics or alpha agonists. And these studies included participants who only included participants who did not have psychiatric comorbidities. So if the participants had ADHD or OCD, for example, they were not included in these studies. And so there are 18 studies with a total of 1,400 participants. And the Western medicine comparators were tiopride and haloperidol. These are both antipsychotic medications, which are known to have a large effect size for tics. All the studies, again, were rated at high risk of bias. And there was evidence of something called publication bias. Publication bias is when negative trials typically are not published, right? It's sort of like a file drawer effect, right? So if you do a study and you don't find a positive result, you're less likely to publish it. So there was evidence that there was this bias present. 11 of the studies reported the Yale as an outcome. And the mean difference on this Yale scale was almost 4 points, favoring acupuncture combined with herbal medicine to Western medicine. Again, so a small but clinically meaningful improvement in tics. There's one systematic review and meta-analysis summarizing literature on massage therapy for tics in children. Again, we chose to look at the systematic review that was done because all the studies of massage therapy have been performed in China and published in Chinese, so we couldn't read those studies. So we relied on this review, which was published in English. So there are 19 studies of over 1,400 participants. The control groups were given a conventional drug therapy with either antipsychotic medications or traditional Chinese medicines, like oral medicines. The included studies, again, were rated at high risk of bias, so we didn't have a lot of confidence in the results. 12 of these studies reported the Yale as an outcome, and again, found a small mean difference between massage and traditional drug therapy, favoring massage, with a difference of about 2.5 points on the Yale scale. So we'll move from here to supplements. So there's one study of the omega-3 fatty acids. It's a class 2 study, included children, and they were randomized to either receive 500 to 1,000 milligrams of omega-3 fatty acids or placebo for 20 weeks. And this was an interesting result because they found an improvement in tic-related impairment, but not in tic severity. So while the number, frequency, intensity of tics was not better, people felt less impaired by their tics. There's one class 4 study of vitamin D supplementation comparing a high dose of vitamin D to a low dose of vitamin D, and this reported an improvement, a greater improvement in the high dosage group by nearly 6 points on the Yale scale, which is, again, a clinically significant improvement. There's one class 4 study of L-theanine and vitamin B6, a combination treatment, comparing this to a psychoeducation program. And again, greater improvement on the Yale scale with the supplement compared to psychoeducation. There's one study, it was a well-done study, a class 1 study of lactobacillus, but there was no difference between the treatment and placebo in tic severity. There's another well-done study, a class 1 study of something called N-acetylcysteine, but this one, again, found no significant difference with placebo on the Yale scale. So we'll move now to traditional Chinese medicine, which is usually a combination of different herbal therapies to treat tics. So there's something called the 5-ling granule. The 5-ling granule has about a dozen different ingredients. Some are flowers, some are plants, some are minerals. And this 5-ling granule was found to lead to a significant improvement in the total tic score as well as the impairment score on the Yale scale. Both of these, like 3.8 points in total tic severity and 6 points of impairment, would be considered clinically significant improvements. There's another preparation called Yi Gan San, which did not find an improvement in tic severity compared to a placebo. Another preparation called Jingxin Zidong, again, a class 1 study, comparing this to aripiprazole, and they found that there was a greater improvement with this herbal therapy compared to aripiprazole, with a small difference of 2 points, but which was statistically significant. But there was no difference between this treatment and aripiprazole in terms of improving impairment. There are 2 different types of Ning Dong granule. So there's one that's been formulated by Zhao. This again was a class 1 study which found a significant difference between the Ning Dong granule and placebo on the Yale, with a difference of about 6 points. And then there's another Ning Dong granule formulated by Wang, and he compared the Ning Dong granule with haloperidol, which is an antipsychotic medication. And there was not full reporting of the results, but the text tells us that there are improvements in motor tics, vocal tics, and total tic scores with patients who receive the Ning Dong granule, haloperidol, or a combination of the two, but not in people who receive placebo. There are 4 additional class 4 studies of traditional Chinese medicine, which I won't describe to you, but all reported some beneficial effects. So we'll finish with other integrative and lifestyle approaches that have been studied. So one is exercise, and there are 2 class 4 studies of exercise in people with tics, both reporting some beneficial effects, both an acute effect of exercise, so an immediate effect of exercise, as well as a longer term effect of exercise. There's one class 3 study of dance. The data were incompletely reported, but it seemed that movement to a song produced a significantly greater improvement in impairment related to tics compared to a control group that moved but not to music. There's one class 4 study of music. This was a before and after study looking at the effects of music. So there were different conditions. There was a music performance condition, after performing condition, mental imagery of performance, and then listening to music, evaluating the effect of each of these conditions on tic severity. And all conditions reduced tics compared to baseline. There's also a study of art therapy, and this was a group therapy intervention compared to a waiting list. And the authors reported a significant improvement in motor and vocal tics on the Yale with the intervention. There are a couple studies of diet. There's one class 3 study on tryptophan depletion, which did not find any effect on the Yale. And there's one class 4 study of the gluten-free diet. Again, this is a before and after study, so there's no control group reporting a decrease in tic severity on the Yale with the gluten-free diet. And then there's two class 4 studies of oral appliances. These are dental devices that sit in the mouth, kind of like a retainer, but different, but the same sort of concept, something that fits in the mouth. And both of these reported some beneficial effects. But these studies, again, were at very high risk of bias, and we don't have a lot of confidence in the results. So I just want to give you some points for us to discuss and to think about. So there's limited and low quality evidence on the use of complementary and integrative medicine for Tourette syndrome. And mainly because most of the studies are very small and they're at high risk of bias. And really the highest quality of evidence we have available is for neurofeedback and traditional Chinese medicine. And for the neurofeedback intervention, you have to have an MRI machine and do the therapy in an MRI machine, which is not really feasible in most places. And the difficulty we have with the traditional Chinese medicine studies is that they develop these proprietary herbal formulations that contain, up to a dozen different ingredients. And these formulations, unfortunately, are not internationally available, which really limits their overall applicability in other settings. The systematic reviews of the published Chinese literature on acupuncture and massage suggest that there are some benefits with these treatments. However, the trials included in these reviews were at high risk of bias, leading us to have low confidence in the synthesized results. So we feel that there's inadequate evidence to support broad recommendations on the use of complementary and integrative medicine for Tourette syndrome. And so clinicians really need to critically evaluate whether the intervention studies could be useful for individual patients and engage patients in shared decision-making regarding their use. I think there are some recommendations we can make regarding future research. So certainly studies of acupuncture, massage, and traditional Chinese medicine, which employ rigorous methodology, need to be performed. And also, if they could be performed outside of China, I think it would be a real benefit to see if we could replicate these results in other settings. And there is a real need for controlled studies of exercise, given the evidence to support the use of exercise in common comorbid conditions, including ADHD, depression, and anxiety. So what practical advice do I want you to leave with? We have some preliminary data on beneficial effects of exercise, dance, music, and art on tic severity. Now, while we don't have a large amount of confidence in these results, these are low-risk activities. They're feasible and enjoyable for many people, and they can be done at home or in a group setting. So, I think that patients and families who want to do something to see if something that doesn't involve medication to improve tick severity, I think it would be quite reasonable to try these things if they could be done at little expense, and especially if these activities are enjoyable. The data, I think the data on music are encouraging because, maybe it's as simple as, you notice that you're having a terrible day with respect to your ticks. Maybe to sort of change how things are going. It could be as simple as, I'm going to take 30 minutes and I'm going to listen to my favorite album. I'm going to put my headphones on, I'm going to sit down and listen to music and see if that has an immediate effect on mitigating tics. So massage therapy and mindfulness, I think, also would be considered low risk interventions. And these things are often covered by health insurance plans. And these things, both massage and mindfulness, provide other benefits, like on stress, for example. So I think these would also be very reasonable things to try. Regarding the dietary supplements, so vitamin D, this is vitamin D. Health Canada's recommended dietary intake is 500 international units per day. And this would be considered, again, a very safe thing to do. Many people who live in colder climates where there's not a great deal of sun exposure can have low vitamin D levels. And so to me, I think it would be very reasonable to think about taking a vitamin D supplement in an effort to improve tick severity. Again, acknowledging that the evidence that we have to support this practice would be considered very limited. And then also omega-3, we have a study which suggests that this could help with tick-related impairment rather than tick severity. And Alberta Health Services recommends getting 200 to 500 milligrams of omega-3s per day. And they suggest that the best sources would be fatty fish, like salmon, herring, mackerel, sardines, halibut, or light tuna. And that by eating at least 2 servings of fatty fish each week, you will get enough of the omega-3s for the whole week. And again, we know that omega-3s have other health benefits, such as like cardiovascular health would be one of them. And so I think that this would also be a very safe thing to attempt.